Strategies of vaccination programs. There are multiple efforts and programs done to promote vaccine confidence and increase uptake. Let's first look at definition of vaccine confidence and vaccine uptake. Vaccine confidence is the belief that vaccines work and are safe. Without this confidence, people will not move toward receiving a vaccine for themselves or their children. Vaccine uptake refers to the proportion of the population that has received a vaccine. About 12 strategies have been recommended by CDC to have increased COVID-19 vaccine confidence and demand. This includes vaccine ambassador, medical provider vaccine standardization, medical reminders, motivational interviewing, financial incentives, school-located vaccination program, home-delivered vaccination, workplace vaccination, vaccination requirements, effective messages delivered by trusted messengers, provider recommendation, and lastly, combating misinformation. Let's see what are strategic programs offered in Malaysia as one of the countries which is also badly affected with COVID since 2019. Vaccine ambassador. Vaccine ambassador are trained community members play a role to disseminate important health information in the communities. Ambassadors are most effective when they are trusted community members and share similar beliefs and characteristics with their peers. Next is medical provider vaccine standardization. This refers to offering vaccination as a default option during patient visits and integrating vaccination into medical practice procedures. Majority of hospitals, both public and private, actively encouraging and promoting the patient for COVID-19 vaccination. Next is medical reminders. Reminders of upcoming vaccination appointments can increase vaccination rates. Messages can be sent by auto-dial, phone calls, or text messages. School-located vaccination programs are events held at a school campus to remove logistical barriers and increase vaccine uptake. These are offered to students only or offered to the faculty. Workplace vaccination programs is another strategy which is held on-site at a workplace to remove logistical barriers and create norms. This can be open to employees only or extended to family members. Next important strategies is vaccination requirement. Vaccination requirements are policies that require employees, students, or patrons to be vaccinated and provide proof of vaccination in order to be in compliance. Next strategies is provider recommendation. Provider recommendation refers to healthcare professionals suggesting that a patient receive a COVID-19 vaccination. This has strong support for increasing vaccination. Among the program is vaccine talks by trained healthcare professionals. Next is combating misinformation. Variety of tactics used to address and dismantle misinformation and disinformation. Misinformation refers to the sharing of false information, while disinformation refers to the information that is deliberately misleading and intended to manipulate a narrative. Last but not least is incentive or advantages. Private company or half-funded organization also show their support by giving or providing special advantages, such as a drive-through vaccination program. As an encouragement, certain restaurant shops provide special price rate for their vaccinated customer. All the strategies discussed earlier aim to ensure vaccine confidence among our population and increase vaccine uptake to help fight against COVID-19 a success.